What I'm going to do is I'm just going to show you where you can find the link on our website. You can actually go straight to the tool as well, but if you're not sure what the link is, the easy way to find it is going to our website, qmul.ac.uk/CEG. And within support for GP practices, explore our resources, software tools, CEG AF tool, and then you can launch the tool from here. So if you click the link, it loads the tool. So that the actual web link for the tool is aftool.qmul-ceg.net. And that brings you straight to the tool. But like I say, you can either just bookmark this page of the CEG website if you want to make sure you're always coming from our website to it. And this is the main launch page that you're greeted with when you see the tool. So the actual support search and report we have hosted on our resource publisher and equivalent for System 1. So you'll find it within your practice support searches. So there's no need to download a search and report, bring it into your clinical system, and then run it. It just needs copy and cross into your practice domain the same way that you do for our practice support searches. You run the search and report, you export it, and then you can bring it into the tool. So I've got a report file with some dummy data that's from EMIS. So we click EMIS Web to choose our system, click Import. I don't know if you can see the browse window that's popped up, you may not, but I'm just going to browse to the report file and open it, and then our tool opens. So you can see it's got a similar kind of look and functions, kind of general functions to the existing APL tool. So it's got a familiar kind of feel to it, but actually improved appearance and much better functionality. So just before we go any further, a little bit of a word around information governance, with this being a web-based tool. So to give some reassurances, although the website is hosted by us, all of the processing that happens when you run the page and you import happens all locally on your machine. So this tool has been custom coded by our in-house team, so we know exactly how the code works, and it's been designed specifically to ensure that no patient information leaves your practice system at any time. So you can click that link to launch the tool, and then you could actually completely disconnect your laptop from the internet. You can plug it, turn the Wi-Fi off, whatever. You can still import your file and run the tool completely fine, even with your internet completely unplugged. Okay, so no processing of patient data is happening on our systems. Your patient data remains on your system at all times. So just a quick overview to give some reassurance around information governance. If anyone has any further questions, then please do just pop them in the chat. So this is the overview page. So we can see that we've got our cohort of patients. So we've got 81 patients in this data report, and we can see that they're all visible within this overview table. And you'll notice that they're all ordered by their CHA2DS2-VASc score from highest to lowest. And we talked about prioritization based on risk, and that's exactly what we were talking about. Drilling into a little bit more, I'm just going to move the Teams part out of the way so I can see a little bit better. We've got the summary view on the right-hand side here, which gives an overview of your AF register, different metrics. So those with the CHA2DS2-VASc score or more, CHA2DS2-VASc score of 2 or more, who were issued anticoagulants, issued DOACs, specifically not issued anticoagulants. So you can get an overview for your practice of what that's looking like. We then have our filter groups here. So each of these drop downs contains some filter options. So you can go through and you can specifically create your own custom cohorts. So if we choose DOAC, you see the DOAC filter is added up here, and our patient list gets filtered by that. We can look for specifically people not on anticoagulant, and we can combine this with other filters to really bring up, those not recorded, or CHA2DS2-VASc score not recorded, and not on anticoagulant. So we can really create, our own custom code using those filtering options. However, actually, what people really want is just to be able to get into the tool and just get cracking with some really key, important, kind of high priority groups or kind of important tasks that need actioning. And that's exactly what our quick filters do. So we've got some predefined filter combinations that you can just in one click get a nice clear cohort that requires some kind of review or action. So going through these, a CHA2DS2-VASc score of 2 or greater recorded on your clinical system within the last 12 months, who are have not been issued anticoagulation in the last 6 months. And those where their CHA2DS2-VASc score, a CHA2DS2-VASc score of 2 or more, was recorded more than 12 months ago in your clinical system and are on anticoagulation, and they may need a new CHA2DS score calculating. Those with a high orbit score who are on anticoagulation. Those whose medication review was more than 12 months ago and are on anticoagulation. Those who are on NSAIDs and an anticoagulant who may need a review to make sure that that NSAID is needed, and if it is, that they're on a PPI. And those who are on dual therapy and whose medication review was more than 12 months ago. So these patients will definitely need a review. So we've got some just quick, easy, you've only got limited time. Here are some key groups to look through without having to think too hard about combinations of filters. But if you really want to get into it and you want to tweak things, you can use the individual filtering options to really drill down and get kind of custom cohorts there. So to get actually more information, although we've got some kind of metrics for our overall population here, so we've got a CHA2DS score, orbit score, whether they've had an anticoagulant issued within the last 6 months, an antiplatelet issued in the last 6 months, NSAIDs issued, statins issued in the last 6 months, whether they're on the CVD register, what their latest blood pressure was, and their last medication review date. We can get more information about an individual patient by just clicking on their name. And this gives us a view for that individual patient with their demographics, key medications that they're on. Now, note, this list of medications is not exhaustive, so we would always advise kind of having the clinical system open alongside for further information that may not be included in the tool. And also, if you're reviewing that patient, you're going to want to write some kind of progress note or make a request or send a task or something like that. So having the clinical system open next to you is very useful. But key medications such as warfarin, DOAC, whether they have a code for third-party prescribing, which can be the case certainly with warfarin, antiplatelets, PPIs, NSAIDs, and statins. Below this, we have then key risk scores. So we've got CHA2DS score, and these are all scores that are pulled from the clinical system. So they've been entered in the clinical system, and this is pulling that information from there. Orbit score and HAS-BLED scores. Then we have key comorbidities. So key ones particularly are grouped in this first row here: heart failure, CKD, ischemic heart disease, stroke and TIA, peripheral arterial disease, hypertension, and diabetes. And if they have any of these, it will flag this here, and then it will give you a list of which ones they actually have, as well as other kind of risk factors and comorbidities such as liver failure, heart failure, bleeding history, some key vulnerabilities such as SMI, learning disability, dementia, and those who are on the palliative care register. Then we have a section around process measures, which is a combination of pathology kind of results and clinical scores and physical parameters. So we have blood pressure, INR, alcohol consumption, audit and audit C scores, renal function, ALT, hemoglobin, and weight. We've then got a section around medication review. So when the code that was added for that medication review and when that was, so you can check the medication review is up to date or whether it needs to be redone. And then some key exception reporting codes. So around anticoagulants, whether they're contraindicated or they're declined, and this will show the latest ever entry for either of those two. Now you'll notice here there's this select for export option as well. And you can see on the list here, we've got these tick boxes. Now what this allows us to do is say we have a particular group of patients that we're looking at. So those who require a medication review, we can go through and have a quick review and go, oh, this person, yeah, this person does need that. We can flip to the next patient. We can review their individual patient review page. And we can go through and we can make ourselves a custom list. So if we decide we don't want this patient, we don't want this patient, we don't want this patient. When we come back, we see those patients have been unselected and only the ones that we wanted remain selected. We can then export a list of those patients, either as an Excel spreadsheet, which we could then send on to a recaller or somebody else for a certain task that needs doing, or we could send it to our pharmacist to say, actually, these patients need a medication review, can you look at those? We can create an Accurix list if there's a particular, an invite just for an appointment. We can create that from there. Or an NHS number list, which we can use. So particularly in EMIS, you can use to create custom lists within population reporting, and then you can, do searches and reports from that list. So you can export the list that you've selected directly from this tool. We also have a link that goes directly to our user guide, which is now hosted on our website. So you can click straight through for there. So if you're not sure about anything, you can click through to there directly, as well as some key external resources, such as our website, nice CKS page around anticoagulation, and a creatinine clearance calculator on MD Calc. And when you're finished, if you want to bring in a new report, you can click load new patient data. I forgot to mention when we talk about the filters, there is also, so you get an overview of which filters are selected in this top blue bar here. So you can see at the moment, because we've selected this quick filter, we've got that they're on a DOAC or warfarin, and that their medication review date was more than 12 months ago. If we add in some parameters here, we'll see these filter options change. What we can do is we can click remove all filters to remove them all, or if we have multiple filters selected and we decide we want to remove some, we can just click the individual cross on that filter to remove it. So it's nice and easy to navigate the filtering options and to create your own custom cohorts.